Good evening and thank you for joining us. We begin tonight with developments from that care home in Quebec where 31 people died in less than a month. At least 5 of them had COVID-19. The provincial coroner's office announced it will investigate the fatalities. That's in addition to investigations by Quebec's health department and police. As authorities look for answers, families are demanding to know how their loved ones could be left in such deplorable conditions. Couteur reports.
Kira Whitehead spent her Easter Sunday outside the Heron residence looking for answers. She knows her 89-year-old father had COVID-19 and died here on Friday. But that's all the information she's been given.
I feel worse because I don't know if my dad was lying in feces or not. I don't know. I don't know anything. I haven't seen him.
Few have seen the inside of the residence where 31 seniors have died in less than a month. The major crimes unit of the Montreal police force is now investigating, as is Quebec's coroner.
We're collecting also documents that we're seizing, notably the stuff like work schedule, list of employees, different types of evidence.
Police say the investigation could take weeks or even months. Quebec's Premier François Legault has described it as a possible case of gross negligence, with reports of residents being left in beds of their own excrement. Despite those difficult conditions, social worker Mandy Novak felt she had to come to volunteer her help.
There's a smell in there, and it's a smell of the deceased and of wounds that need to be taken care of and were not taken care of for a long time.
The province has said at least 5 of the 31 deaths inside the home were linked to COVID-19. The number of Canadian long-term care homes that have been ravaged by the virus continues to rise. Hundreds of facilities across the country have been hit by outbreaks, with elderly populations being more susceptible to the virus.
This is why we've characterized these homes as tinderboxes.
Dr. Samir Sinha helped the federal government develop recently released national guidelines for long-term care facilities to protect them from outbreaks with a so-called iron ring. Procedures like preventing people from working in multiple homes and making sure both staff and residents wear masks.
When we are having a case appear in a home, that we're actually promptly not only testing and isolating those who look like they're symptomatic, but also recognizing that people could have been infected who are asymptomatic.
Dr. Sinha acknowledges having those guidelines in place a month ago could have saved lives, but he says having them in place now will save many others. Couteur, Global News, Ottawa.
Quebec has been hit the hardest by COVID-19. The province now has more than 12,000 cases and 328 deaths. Overall, Canada has more than 24,000 cases. COVID-19 has claimed more than 700 lives in this country. For the first time in history, every U.S. state is under a disaster declaration. There are more than 550,000 confirmed cases of COVID-19 in the U.S. At least 21,000 people have died. The U.S. has suffered more COVID-19 deaths than any other country in the world. And as Jennifer Johnson explains, there's concern more Americans could die if President Trump reopens the economy too soon.
A nation praying for hope this Easter Sunday, in some cases through video. In a handful of states, worshipers ignored health experts and congregated in churches.
This Easter will be much different than others.
In his Easter address, U.S. President Donald Trump promised America will soon get back to normal, despite COVID-19 infection and death rates still on the rise.
It's a plague on our country like nobody's ever seen. But we're winning the battle, we're winning the war.
This week, the president plans to meet with his new task force on reopening the economy with a targeted May 1st date. Already his own health experts are pushing back, saying they still don't have the right diagnostic tests to protect people.
This team of experts, all of government approach, they're focused at looking at the earliest possible time that we can get Americans back to work safely and to give Americans the confidence they need.
World health experts also urging caution.
We think it's going to be a virus that stalks the human race for quite a long time to come until we can all have a vaccine that will protect us.
The nation's top infectious disease expert now admits concerns about the economy led the U.S. to wait too long, mid-March, to order protective measures to stop the spread of the virus.
Obviously, if we had right from the very beginning, shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
As the virus keeps tens of millions of Americans out of work, food banks are stretched to their limits. People waited in their cars for 2 hours at this distribution site in Hawaii.
I've never seen anything like it, but I don't think America has ever seen anything like the COVID crisis that we're having right now. This is extraordinary.
Meanwhile, the Treasury Department says tens of millions of Americans will start receiving their coronavirus stimulus payments next week. Some hope on this Easter Sunday for millions suffering from this pandemic. Jennifer Johnson, Global News, Washington.